They could set bones, although sometimes setting bone, if it's an extreme fracture, they may not be able to fix it perfectly. They did do amputations and without anesthesia, but the amputations they described are pretty similar to how a doctor would do it today. Sorry, it's going to get a little gruesome, but without the electric saws that they use. And we do know that people survive those. So if you had a severe break or gangrene or something, they could perform an amputation. But again, whether or not the patient survived the shock of it or if an infection followed, we don't know. But there are definitely people who survived that. They could remove like arrowheads, spearheads from the bones, and there are a couple different ways they would do that. The doctor who was skilled in that would either just, if it was on a clear trajectory, the best case scenario was to actually push it straight through. Spearheads are usually barbed. So if you pull it out, you could actually do more damage. So one way, if it was safe to do so, if the doctors thought it was safe to do so, just push it through. If they couldn't do that, they would take a speculum and just spread open the skin, and you could pull it out that way and then clean it up. Suturing's very common. They could do that. Other surgical procedures for the eyes, they did actually do something called couching a cataract, which apparently doesn't hurt, but basically they would take people and try to move the cataract out of the way of the eye using very thin needles. And apparently that was done until very recently in certain countries. It doesn't remove the cataract, but at least it kind of moves it out from vision. But apparently it doesn't hurt, but I cannot imagine somebody coming at me with a little needle. So they would have people holding the patient down. Other surgical procedures, most of it was just removing growths and things on the surface. They didn't do open heart surgery or brain surgery, anything like that. Though they did do trepanation, where you drill a hole in the bone of the head. And there are a couple different theories about why they may have done this, but part of it was maybe to relieve pressure or get rid of a bad humor or something like that. But there have been some skulls found with the bone growing back, so that we know that people did survive this. It was mainly those types of procedures that they followed. If you're very interested, I suggest reading book 7 of Celsus de Medicina, or On Medicine, because there he describes lots of different procedures.